Good morning, everyone. My name is Samuel Bro from the Mental Health Commission of Canada. Thank you so much for joining us for our 13th webinar on workplace mental health, where today we'll be talking about the working mind. And so before we start, just to go over some house rules to make sure that everyone's experience is as enjoyable as possible. We will be playing back some recordings today, and so in order to properly hear them, we would recommend that you phone in and have your computer muted so that you don't hear the echo. Otherwise, you might not get the best sound possible. And just a little heads up that we think there might be an issue in seeing the video. Although you will hear it correctly, you might notice some lagging time. But that is something of a technological issue, and we did try our best, but you will hear it well. It might just be an issue from the video side. It would be great if everyone could introduce themselves through the chat function, which can be found on the right of your screen. As shown on this slide, if you do not see the chat box, you can scroll to the top of your screen and a chat option should appear. This is where you can ask questions or make comments either during or after the presentation. When asking a question, please send them to all participants, which can be found in the drop-down menu beneath the chat screen. I also want to mention that this webinar is being recorded so it can be archived and viewed on our MHCC website following the presentation. A French version of the slides will also be available in the coming week or two. And so because there's a large number of participants today, please make sure that you are on mute, or else we might hear some background noises during the presentation. If you have some questions for me only, you can send it to the host, which can also be found in the drop-down tab in that chat function. So if you are listening on the telephone, make sure that your computer is muted, or you may hear echo when we play the videos. So for our presentation today, we're joined by three great folks who are involved in different ways in workplace mental health. And so we have Claudia Canales, who is Manager of Workforce Projects at the Mental Health Commission of Canada. Her role includes overseeing the implementation and coordination of workplace mental health, mental illness, anti-stigma, and mental health promotion programs across Canada. Claudia holds a BA in Sociology and a Master's degree in Clinical Social Work from the University of Calgary. Dr. Andrew Szeto is currently a research scientist at the Mental Health Commission and an assistant professor in the Department of Psychology at the University of Calgary. Much of his research at the MHCC involves the evaluation of workplace mental health illness, anti-stigma, and mental health promotion programs. He currently works with numerous organizations from different sectors across Canada to implement and evaluate these programs. One of his current successes has been the development of a workplace mental health awareness and mental illness stigma reduction program called The Working Mind. Laura Smith, joining us from Capital Health, has a bachelor's in science and is a workplace health promotion coordinator with the Organizational Health Department at Capital Health in Nova Scotia. She has worked 10 years with Capital Health's Wellness and Respectful Workplace team and brings experience in many areas, including programs, planning and evaluation, organizational health, research, and health promotion. Laura enjoys learning something new every day, is passionate about her work, and we're so happy to have her join us today to talk about her experience from the Capital Health in Nova Scotia. So our agenda today is going to be to briefly look at the national standard for psychological health and safety in the workplace, and then really delve into Opening Minds and the Working Mind program, followed by an experience-based presentation from Capital District Health Authority, and then we'll close the session with a question period so that we can answer some of the many questions that we've already been receiving from participants. So as a first introduction, really framing the conversation is the national standard for psychological health and safety in the workplace. And so the standard was launched in January 2013 and is the world's first standard that enables an organization to look at promoting and protecting psychological health and safety, much in the same way that we would look at, traditionally look at physical health and safety. We're now brought on to looking at psychological health and safety with a similar lens. And so the intent of the national standard really is to promote wellness for all, and at the same time enable employees and the employer to have a conversation on the same understanding. So really reducing stigma, reducing some of the stressors that can be controlled in the workplace, really with the overall goal of having a happy and productive workplace where employees feel safe and are able to be as productive as they can be. So the purpose of the standard, as mentioned, is twofold. It's preventing the psychological harms that could be present in the workplace and that can be controlled. And so we know that in some settings, the psychological harms will not be preventable because they are part of the work. There can be hazards. If you're a first responder, you know you would be more likely to facing psychological harm. And the other aspect of the standard really is to promote psychological health. And so making sure that employees understand the tools and resources that are available to make sure that they can come to work as happy and productive as they can be. So the standard really is a set of guidelines and tools and resources for the employees and the employer to create that positive workplace. And so it's a voluntary set of tools. It's not really a rules, and it doesn't set a minimum or standard baseline that you should meet, but rather is meant to be a process of continual improvement. And so that year upon year, an organization can say that they are improving specific measures or specific areas of their workplace mental health. And so it helps employers mitigate the risks that they know are there, and at the same time promote positive mental health for everyone. And so linking into that, there are different programs and tools and resources that can be used to help implement some aspects of the standard. And so today, we have Szeto and Claudia Canales, who are going to talk about Opening Minds and their program, The Working Mind. And so I'm going to pass it over to Andrew. We seem to be having a little bit of a technical glitch here, but Andrew should be coming online any minute there. In the meantime, I'm wondering if our colleague Claudia might be able to jump in.
We're both muted on their computer?
Not anymore, you just got it.
And then Andrew as well?
You're both on the same.
Okay, but this one. Samuel, can you hear us now?
Yes, you are online.
Okay, we were having some technical difficulties.
The technology is never easy.
So I'll start again. So good morning and good afternoon, depending on where you are in the country. Before we talk about the Working Mind, I just wanted to give you a little bit of a background on what Opening Minds is. So essentially what we are is the anti-stigma initiative of the Mental Health Commission of Canada. What we started out with was the philosophy that we know that there are anti-stigma programs out there, and there's a lot of good ones out there, so why reinvent the wheel? So what we are doing currently and have been doing for the past several years now is identifying successful anti-stigma programs that exist in the country, and we do this through scientific evaluation. By evaluating these programs, we identify the ones that are doing exactly what they say they're doing, and that is reducing stigma. So the programs that we identify as successful will promote across Canada and help them implement. And those ones that do not do well, we will try to help work with these programs and organizations to help them resolve those problems and get them to where they should be. But we have 4 specific target groups where we work with organizations and help them implement and evaluate these programs. We have target groups in healthcare providers, the youth, the news media as well. We are working with the workplace, and that's what we're here to talk about really today. In the past and present, we have had approximately 140 different partners, and currently we have, it says 16 active partners here. I think we keep adding new partners in the workplace every day, so I think our numbers are quite a bit more than that. Next slide, please. So here are just some of our partner organizations that we have are currently working with Opening Minds, and again, they span all across different sectors and across Canada in various provinces as well. So we know that there are moral and emerging legal reasons to address mental health and mental illness in the workplace, but we know that there are also financial reasons, and this is quite pertinent for the workplace. But mental illness, it costs the economy approximately $51 billion a year, and these are due to costs such as direct healthcare costs and indirect costs such as short-term, long-term disability, losses in productivity, and losses in quality of life as well. The second stat there is 1/3 of disability claims are related to mental health problems and mental illnesses, but actually they actually cost approximately 70% of total disability claim costs. So that's equivalent to approximately $15 to $33 billion a year Canadian. To get a little bit more in depth, Carolyn Dewa and her colleagues conducted a case study in Ontario organization, and what she did was over a span of a couple of years looked at all the disability claims in that organization, and she found some quite interesting results. She looked at disability claims and categorized them to what source they came from. She looked at the disability length and found that the average episode of a claim lasted approximately 33 days. A respiratory episode lasted about 11 days, but if you look at mental illnesses as the source or cause of that claim, it's actually about double the average and about 6 times that of the respiratory claims, and it lasted about 65 days. And if you look at the costs, they're about the same, or they're reflected in the costs as well. You look at the average episode, it's about $9,000 per episode. If you look at respiratory, it's approximately $3,000. But if you look at mental health, mental illnesses as the source, it's approximately $18,000 per episode. So you can see the costs of mental illnesses in the workplace in this specific example. So we know that there are reasons to address mental health, to try to decrease mental illnesses in the workplace, but why is it also important to reduce the stigma of mental illness? So to help us along, I'd like to use an analogy. There's this concept or idea called threshold concepts that comes from education research, and what this concept is, or what this idea is that threshold concepts, once you learn or retain or gain this information or knowledge, it opens up the whole topic area. It leads to increased understanding and changes how you view the whole topic area. So I see reducing stigma in the workplace as a threshold concept. So if we reduce the stigma of mental illness in the workplace, people seek help earlier. This leads to better prognosis, better outcome for the individual who may have a mental illness. It also increases productivity in that person, and in general, it has a positive financial impact for the organization. And I think very important, by reducing the stigma of mental illness in the workplace, it creates a more supportive, productive, and safer workplace for everybody. So I think it's very important to first reduce the stigma of mental illness in the workplace. So I'm going to hand it off here to my colleague Claudia, and she's going to start talking about some of the aspects of the working mind.
Thank you, Andrew. So this brings us to the working mind, which is the main focus of today's webinar, to learn a little bit more about this training program. And so the Working Mind is an education-based workplace training program that aims to reduce the stigma of mental illness, promote mental health and resiliency, and it strives to create an inclusive and supportive work environment for anyone experiencing poor mental health or a mental illness. The Working Mind, as you can see, is adapted from the Department of National Defense's Road to Mental Readiness program. And this particular program is designed to increase mental resiliency of soldiers and their families as well, actually, to deal with stressful and traumatic situations. As Andrew mentioned, the Mental Health Commission has done a fair amount of research into best practices that are very successful at reducing stigma and increasing mental resiliency, and this is very much one of those programs. It has a very strong evidence base behind it, and the Department of National Defense has been providing this training, but also evaluating it for over 6 years now. So before getting into some detail about the Working Mind, we do want to just briefly touch on the Road to Mental Readiness program, because the Commission has also adapted the Road to Mental Readiness program for a police service or a first responder workplace. And as you can see on the map there, we are currently implementing Road to Mental Readiness with several police services across Canada, and we wanted to include this in our presentation today just in case anybody who is attending the webinar is from a workplace that you would categorize as a first responder or a police service, so that you're aware that there are two training programs for the workplace. One is specialized around first responders or police services, and the other, which we're going to be largely talking about today, the Working Mind, is for a general workplace audience. So in front of you there is just a quick example of what we refer to as pocket cards, and it's your first glimpse there at the mental health continuum model, which we're going to talk about in a little bit of detail today, which is one of the main components of the Working Mind and also the Road to Mental Readiness program. And these are just 3 examples of police services who have adapted and implemented Road to Mental Readiness program. And you can see there their customized wallet cards. So back to the Working Mind, and as I said before, the Working Mind is the education-based program that is adapted for any general workplace audience. And we have a number of objectives with this particular training. First and foremost is it's to reduce the stigma of mental health problems and illnesses. So that we know to be perhaps the largest barrier that individuals encounter in order to seek help. So that is definitely one of the main objectives of the overall training. In addition to that, we also strive to promote mental health in the workplace. We strive to reconceptualize how employees and individuals and managers think and talk about mental health and mental illness. Help employees identify poor mental health in themselves and others. Next slide, please. And we also, in the training, we strive to teach coping skills to manage stress and poor mental health. We have a leadership-specific training session or package, which we will see in a few slides here. And in that, we review the employees, the managers, and the employer or the organization's mental health rights and responsibilities. And overall, we strive to create a more inclusive and supportive environment for anyone. So, of those objectives, the main components of the training include an anti-stigma module where we incorporate contact-based education via videos. We show a number of videos throughout the training, which we will see a couple of today. And we know this to be best practices in terms of reducing the stigma associated with mental illness. And again, stigma is the largest barrier to help seeking. In addition to an anti-stigma module, the Working Mind training also includes the mental health continuum model, which we're going to see up next in a couple of slides. And we also teach what we refer to as the Big Four skills, which include SMART goal setting, mental rehearsal or visualization, positive self-talk, and diaphragmatic breathing or tactical breathing. And these Big Four skills are based in cognitive behavioral theory, and when grouped together, we know that they are very highly effective at combating stress and increasing resiliency. The mental health continuum model, which we're going to visit in a couple of slides, is a self-assessment tool that's used to gauge one's mental health or that of an employee or someone else. And it is a reconceptualization of how we view our mental health. Next slide, please. So we'd like to play a video, and as Samuel mentioned, you may have some difficulty seeing the video, but we know that you can hear it. And this is just one of two examples we're going to provide today of videos that we use throughout the training package that teach different points along the training day. Thank you, Samuel. So that was one of the videos that we show, and again, that is just helping us illustrate the point of what stigma is, how stigma is experienced in the workplace. In the next slide, what you have in front of you is an old way of conceptualizing mental health or mental illness. We used to see mental health and mental illness as either being healthy or ill, one or the other, very black and white thinking. And one of the things that the mental health continuum model strives to do is to get away from this type of conceptualization of viewing mental health. Next slide, please. So what you have in front of you is the mental health continuum model, and as you can see, it's divided into 4 different colors, 4 different categories. It moves from positive mental health to ill or poor mental health, and each color has a different list of signs and indicators that we can use to evaluate how we're doing in terms of our mental health. You'll also notice an arrow right underneath the colors, and the arrow signifies the ability to move back and forth along the continuum. So what we promote or what we teach is that even though you may find yourself one day in the orange or under the injured, it is very possible to move back to the green. You can be in the red and also move back to the green. So what we try to promote is that that recovery is possible at different points of the continuum, and we also encourage help-seeking behavior, particularly if someone finds themselves in the yellow or in the orange. This particular mental health continuum concept also strives to eliminate the need for those stigmatizing labels. So we focus mostly on looking at one's behavior, one's mood, one's performance, thinking and attitude, and we try to get away from using terms like depression or anxiety disorders. So again, this is a self-assessment tool, but in the leadership package, we also teach managers and leaders to look at the different signs and behaviors in their employees so that they may be of help or support to an employee who may be moving to the right of the mental health continuum. And on this slide, you see a more complete version of the mental health continuum, and as you can see on the left-hand side there, there are changes in mood, thinking and attitude, behavior and performance, and physical changes as well. So again, healthy would be in the green, yellow would be in reacting. We still consider this to be a normal reaction to everyday stress. When we're in the yellow, we are reacting to a given situation. We don't tend to stay there very long if it indeed is yellow, and we tend to bounce back into the green. When someone moves into the injured, we see that the different indicators or signs are a bit more persistent or pervasive in nature. And then, of course, in the red, someone experiencing those signs and symptoms would be experiencing those throughout the majority of their day. And what we teach is that as signs and indicators go up, or you move to the right of the continuum, overall functioning tends to go down as well. And the overall goal of using this as a self-assessment tool is to try and reach people in the yellow or in the orange before they get to the red, so that we can improve help seeking and improve the length of recovery as well. So this brings us to our second video that we're going to show today, and this video we use to end the day of training, and as you can see, it focuses on a description of recovery. So similar to our program for first responders and police services, the Working Mind also comes with a supplemental resource which we refer to as a wallet card. And this is encouraged to store in one's wallet, in one's pocket. You can tack it up on your cubicle. Some organizations have also created larger posters which they put up in public areas such as a staff room or on filing cabinets, anywhere visible, so that the mental health continuum model on the one side, and then on the other, which lists some strategies, including the Big Four, are visible for an employee throughout one's day at the workplace. Next slide, please. The Working Mind is delivered in two different versions. So we have a version for employees, which is 3 hours in length, and it contains all of the main components that we've highlighted today. And then we have a manager or leadership workshop, which is 6 hours in length, which also contains the main components. But in addition to that, we also teach managers how to address an employee's mental health at each stage along the mental health continuum. In that respect, we teach managers what their roles are for an employee who's in the green or who has positive mental health, but also we teach them how to notice a change and what their role is if they have an employee in the yellow, the orange, and then in the red if an employee is off work with a mental illness or at work with a mental illness. We teach leaders what their role is in supporting that employee in that situation. We also provide in the manager training session information on accommodations and the rights and responsibilities of the employee, that manager, but also the organization as well. And in addition to that, we invite someone from, a representative from HR, from that organization to come and give a brief 10-minute presentation on the different resources that the managers and leaders have access to. And we incorporate that into our scenario work at the end of the day, where we sit down and we take a look at different scenarios that a manager, but also what an employee could encounter, and how to apply the mental health continuum as well as the Big Four. Now, the reason we have a separate manager workshop is because we know that managers are largely responsible for shifting and creating a culture within the workplace. And as we outlined in our objectives, that's one of our main goals with the Working Mind, is to, again, improve the culture of a workplace to be more inclusive and supportive. Next slide. So although in some settings we do provide on-site training, we do recommend and encourage that organizations adopt the train-the-trainer model of delivery. And in the train-the-trainer course, it's 5 days in length. Facilitators are chosen from within an organization to become Working Mind facilitators, and they attend this 5-day course to essentially learn how to deliver both the employee and the manager leadership training for their own staff. Throughout the training, we cover the key concepts that a facilitator would need to know in order to deliver the training, such as information on mental health, workplace-specific information, information on accommodations, and then, in general, adult education principles. There's many opportunities to practice delivering the content throughout the week, and at the end of the week, participants are evaluated on their skills and knowledge of the working mind, and we find it to be a really successful means of delivering this content because it is very sustainable. It promotes that cultural change which we're trying to achieve, and it also provides each organization with those on-site content experts that can be that source of mental health information. I'll hand it back to Andrew to take you through the evaluation components.
Thanks, Claudia. So right now, I'd just like to take a little bit of time to talk about our what we've been doing with the working mind and some of our preliminary evaluation results. As Claudia mentioned, our train-to-trainer sessions have been quite successful. Currently, we've trained approximately 50 trainers in various 5 organizations to present the working mind in their organizations. And since approximately January 2014, we've rolled out to approximately 1,000, if not quite a bit more than that, employees and managers since that time. With all our programs or implementation, we do evaluate the programs to see if they are doing exactly what they say they're doing. And again, that's what one of our major goals of Opening Minds is to identify those successful programs through scientific evaluations. But with the working mind, what we're doing is essentially assessing if the program reduces negative attitudes towards those mental illness, seeing if the program increases resiliency, and if it increases people's skills to cope with stress and adversity. We also examine mental health and well-being, as well as things such as presenteeism, and we also gather feedback on the program itself. The way we evaluate most of our programs is with a pre-workshop questionnaire, post-workshop questionnaire, as well as a follow-up questionnaire. And again, this is how we evaluate most of our programs that are across Canada as well. So I just want to share with you some of our preliminary results with approximately 550 to 600 employees and managers in our various work sites. And these are preliminary, these are pre-post results that we're seeing, and they're mainly with the measures that we're using, the quantitative measures. But what we're seeing is there's significant decreases in stigmatizing attitudes in managers as well as employees. For those who are more statistically inclined, that's a medium to a large effect size. We're also seeing significant increases in resiliency skills, and those are medium effect sizes. We're also seeing more positive attitudes in managers in general. In addition to the quantitative results, we're also doing more qualitative methods as well, including interviews and focus groups with participants and organizations and our trainers as well. But our qualitative results generally corroborate our quantitative results, and essentially they're showing that participants are becoming more aware of stigma, making them understand the issues and topics that are involved. One of the quotes that we keep seeing multiple times is that the working mind is an eye-opening experience. Participants also talk about the skills that they receive. They find that it's quite relevant for their work life as well as their personal situations, or they can use it at home. And generally, our workshops are very well received. Our participants really enjoy the videos. They enjoy the interactive nature of the workshop, and they really enjoy the presenters that are the trainers that we have who give the workshops. So I just wanted to highlight some of our current partners. We have partners all across Canada, some in the east and some in the west. You can see some of them here. So we're currently implementing and piloting the working mind in these various sites across Canada, and we're continuing to implement and pilot the program in upcoming sites as well.
So up next, we'd like to hand it over to Laura Smith, who is the Workplace Health Promotion Coordinator for Capital Health in Halifax. And Laura, well, Capital Health is at one of our partner sites and has very graciously agreed to be part of our webinar today to speak about their experiences in implementing the Working Mind. Laura?
Hello, everyone. I'm really happy to be speaking with you today about Capital Health's experience partnering with Opening Minds of the Mental Health Commission of Canada, and I'll be specifically talking about our experience with the Working Mind. I'd like to tell you a little bit about us. Capital Health is Nova Scotia's largest provider of health services. We operate hospitals, health centres, and community-based programs throughout the Halifax Regional Municipality and the western part of Hants County. We have over 12,000 employees, physicians and learners, and approximately 1,900 volunteers. We provide medical and surgical care, mental health care, community health programs, addiction prevention and treatment, and environmental health services. We provide services through 9 hospitals, as well as dozens of community health centres across the region. We are an academic district, and we serve the 400,000 residents of the Halifax region and provide specialist services to the rest of Nova Scotia and Atlantic Canada. So I'll share with you now a little bit about how we got started and how we got involved in this process. As part of the development of a strategy to address mental health and addictions in the workplace, we identified mental health stigma as an issue that we needed to address. We learned about Opening Minds in late 2012 and started having conversations with Mike Petrus, the director of Opening Minds with the Commission. And it was through these conversations that we learned of an opportunity to participate as a pilot site of the Working Mind. After several calls and emails and lots of conversation, we were ready to sign an affiliation agreement with the Mental Health Commission of Canada for this work. In September of 2013, we trained 10 facilitators who were Capital Health staff. Facilitators, as Claudia mentioned earlier, received a week of training, and we left that training with the materials needed to offer the Working Mind in our workplace. We decided that we would offer the training first to our management staff, and we defined that as people who had people reporting to them. We also offered the training to staff who support management, for example, human resources consultants, occupational health nurses, rehabilitation consultants, etc. We called these sessions the Working Mind for Leaders, and we offered our first training session in January of 2014. Between January and June of 2014, we held 12 training sessions and trained 114 people. At the time, we had 307 people in management roles, so we trained approximately 1/3 of our management staff. Our sessions were held in various locations across the district to try to accommodate our various participants. Overall, the Working Mind has been very well received by staff, and in this slide and the next slide, I'm sharing with you a few of the quotations we've received and comments we've received from attendees of the Working Mind for Leaders. I love this one. It talks about how it is the most useful and informative session attended during the many years at Capital Health. We offer an awful lot of training within our organization, so to hear that from a participant in a management role with limited time is really a wonderful thing to hear. Providing those aha moments and the useful tools within the session and the better understanding of the mental health issues. So that's what one participant shared. We also heard from people that the information was really valuable. They received good resources. It has given someone confidence and the information on who to contact when needed. Being better equipped to have those conversations, deal with the situation correctly, and support individuals appropriately, as well as understanding challenges and the coping skills and resources that are available to us. The biggest challenge that we heard from participants was time. So the sessions were a full day, and it's very difficult for our management staff to go to the workplace for a full day. However, word of mouth is very powerful. As difficult as it was to get away from work, we were able to train 1/3 of our management staff in a relatively short period of time. After the first few sessions, we had people signing up because they had heard such positive things about the program from their colleagues. We are also very, very fortunate at Capital Health to have some fantastic facilitators who volunteer to take the training and offer this outside of the jobs that they have within our organization. They are dedicated and passionate and really interested in making a difference in supporting their colleagues within this organization. I've shared with you a statement from one of our facilitators talking about how rewarding it was to see those reactions of insight when sometimes for the first time people were pondering stigma and mental health and addictions in the workplace, and their belief that we'll continue to see this positive change as we move into training our employees. So the next steps for us, starting next week, actually, we will be offering the shorter version, which will be about 3.5 hours for us, of the employee sessions of the Working Mind to the employees here at Capital Health. And as Claudia mentioned earlier when talking about the program, the biggest difference between the employee piece, one of the big differences, is that it doesn't have the accommodation information that was specific to the management piece. We will run these programs until the end of December of 2014, and our aim is to train, to have 500 of our staff take the training in this time period. At the end of December, Capital Health's involvement with the research aspect of the Working Mind will come to an end after our employees have completed their 3-month follow-up. However, our intention is to continue offering both the leader sessions and the employee sessions on an ongoing basis. And like many others, we are eagerly awaiting the results of the research and are thrilled to have been part of this exciting work. Thank you. I just see a quick question there, and our training sessions were not mandatory, they were voluntary.
Excellent. Thank you so much for that great presentation. So we're just compiling a list of questions that participants have been asking us during the presentation. And so just a reminder that if you don't see the chat box, you can scroll to the top of your screen and a chat option should appear. This is where you can ask questions or make comments. When asking a question, please send them to all participants, which can be found in the drop-down menu beneath the chat screen. And so just looking at my colleagues here for the first round of questions to ask our lovely presenters here. And so one of the participants asked us, how would Working Mind compare to using mental health first aid? We've been delivering mental health first aid to our employees and supervisors since 2008. So that would be a question for Claudia and Andrew. Sorry to put you on the spot there.
No worries, great question. Andrew?
Yeah, we actually see this question quite often, but mental health first aid and the Working Mind are actually quite complementary. We see the Working Mind as more of an prevention tool, right? To get people to understand their own mental health and to get them to seek help before anything arises. Whereas mental health first aid we see as more of the back end, right? If somebody is experiencing some kind of mental health crisis, people can intervene and help them out. So again, we see them as programs that are quite complementary and quite useful in the workplace.
In addition to that, as we mentioned, the leadership training includes education around accommodation and how to have those conversations with an employee who has come forward and requested some modified duties or is going to be going off on a medical leave. And we also provide training on how to support them when returning to the workplace as well. So again, that's all in the area of, as Andrew mentioned, promotion and prevention.
Excellent.
Great.
Thanks so much for those answers. And yes, that was a great question. And we see a lot of curiosity from different programs and resources. And I think to your guys' points is that a lot of these are complementary. And so seeing them as working together rather than one being better than the other one. We have a question that's specific about, I guess, logistics for you, Claudia and Andrew, as to whether there is course availability, location, times, dates available on your website. Could you maybe provide some more context around that?
Absolutely. The way we deliver the Working Mind is actually very customized to each organization. So we don't have a list of scheduled training dates available where anyone can sign up and attend. The way we go about delivering this training is we work with individual organizations and we select dates that are great and ideal for them, as well as the master trainers who come in to deliver the 5-day Train the Trainer. If the situation is where, in a couple of instances, really organizations with a small number of staff who don't wish to roll out the 5-day Train the Trainer, we can work with them as well to bring the training in to their organization on an as-needed basis.
Excellent. And so I'm assuming that for anyone that would have more questions around specifically about their organization should likely just get in touch with you and find out more about that information.
Yes, absolutely.
Right. So we have a question for Capital Health, and Laura, you'll be happy to see that you have many employees that are listening, and one employee asks, how does an employee at Capital District Health get involved? And perhaps you could just share with us more broadly around how our employees engaged in the mental health conversation more broadly.
Great question. So for any of the Capital Health employees who are listening, for the employee session, the dates are currently listed on our LMS website. So you can sign up, and there are dates listed from starting next week until the end of December. So that's how you can take the employee version of the Working Mind within our organization. If people are interested in having a broader question about our mental health and addiction strategy that we have overall for our organization, please get in touch with me. There's a huge conversation that we can have. We can review the strategy, and if people want to be involved in the steering committee for that work, they can certainly reach out to me.
Excellent. Thank you so much. We have another question that's specifically around the continuum model, and I guess we must have some really great experts or coding other models. And so a question around if you've worked with the dual continuum model of mental health created by Corey Keyes. That would be for you, Andrew, or Claudia.
Yep, no, that's a good question. I am aware of Corey Keyes' model, and essentially that model talks about how mental illness and mental health are on two different orthogonal continuums. This is a great model, and there's some research to support this model. I think it's a good theoretical model, and I think there's a lot of great research being done with that model. As a more practical model, I see the mental health continuum model that we're using in the Working Mind as a little bit more useful, as it indicates the signs and indicators of mental health from green to red, whereas the Corey Keyes' model, there's a little bit more complexity in that, and for our model, the mental health continuum model, we want people to seek help regardless if they have a mental illness or if they have poor mental health, and we see those things as similar in that, if you're declining or going into the orange and red, and even in yellow, we want people to seek help. So to sum up, I think Corey Keyes' model is a good model, more theoretical, more research-oriented, whereas our model, the mental health continuum model, is more practical and more user-friendly and more applicable in especially the workplace.
Great, thank you so much for that great answer. We have a question from one participant that asks around the aging workforce, and more specifically to see if there are any mental health issues specific to older workers that need attention. And I would like to open that up maybe to just more broadly. How does the Working Mind program help meet some of the specific needs that you may find in the population of employees, whether it be an older aging workforce or even caregivers in the workplace? And I'll open that up to all three to answer. Maybe ask Laura first if you have any words, and then go over to Claudia and Andrew.
Hi. Yeah, so I can answer from the perspective of organizations, and we absolutely do have an employee and family assistance program. I think I see that as the question there on the screen. It's not specifically linked to the Working Mind programming, but we do hand out our EFAP brochures and information during the training. And as Claudia mentioned in her presentation, they do cover aspects of setting SMART goals, self-care, et cetera, that could be applicable to a wide variety of situations and issues that may happen or occur in the workplace that people may need to pay attention to.
That's a great response, Laura, and what I'll add to that is when we showed that fuller picture of the mental health continuum model, that only included just some of the indicators underneath each of those different levels, such as mood, thinking and attitude, behaviors. There is a much more complete version of the mental health continuum model, which includes a variety of signs and indicators which can be applicable to anybody, any life stage, and really anyone in any type of a workplace setting or life setting. And as Laura mentioned, when we teach the resiliency skills, the big four, visualization, positive self-talk, tactical breathing, and goal setting, they can be applied to any situation by anyone. They are very much a skill set that can be learned and mastered. So the beauty of this particular training is that it can be applied to, as we said, any workplace or any life stage.
Excellent. Thank you for those great answers. So I have two more questions here that I think we can answer before the end of the webinar. So I'll start with the easier one for you, Claudia and Andrew. This one's specific to the train the trainer sessions and goes back to some of your earlier comments. But how would one go about organizing a train the trainer session, and any ideas around cost?
Well, to get this going, all you need to do is contact us, and we'll walk you through all of the various steps that are included in organizing a train the trainer. But basically, in a nutshell, what we support you to do is to find those key people within your organization who either already have a role in training or who have a passion and or education and or experience in the area of mental health. Sometimes some of the best facilitators are individuals who have come forward and said that they have recovered from a mental illness as well. So there's a number of different factors that go into choosing your facilitators in an organization, and we support you at every step of the way in that process. If anyone is interested in getting more information around the fees and the costs, please email me directly, and I can send you a list of the different costs associated with the different modes of delivery. Excellent.
Thank you so much. And finally, this is a question I feel we could probably offer a separate webinar on, but I'll throw it out to see to get your thoughts on. One participant asks, why don't we use the term mental wellness rather than mental health or mental illness to get rid of stigma in the workplace? So any thoughts on that, Andrew, Claudia, or perhaps even Laura?
That's an excellent question. We do talk about mental wellness quite a bit in the program. We do try to shy away from using mental illnesses. We rarely actually in the program talk about mental illness. We talk about, again, signs and indicators. We talk about the colors, and I think the colors are much less stigmatizing than using terms as Claudia mentioned, such as depression or anxiety disorder or things like that.
Yeah, I think that's a good answer. Just to add to that, when we do use the term mental health, we use it very much as an umbrella term and underneath mental health, when we deliver our training, we actually go through the different concepts such as good mental health, declining mental health, poor mental health or mental illness, and we also talk about resiliency. So we use mental health as an umbrella term in the actual training itself. But that's a great question, and then one that I think we will continue to ask ourselves along the way of delivering mental health promotion training.
Excellent. And Laura, did you want to jump in?
Hi there. I think Claudia and Andrew answered that quite well, and I agree with everything they said. Excellent.
All right, well, we're just about running out of time, and so before we leave, I'd like to invite participants to continue the conversation online, and as you can see on the screen there, the Mental Health Commission administers what we call collaborative spaces, which is an online repository and conversation place for mental health in Canada. And the idea is to share mental health information with others and learn from others as they post. So it's really meant to be informal and not, coming up with long formal answers, but really just to be about bouncing ideas. And there's a space that's been made just for workplace and caregivers topics. You can add content, events, and chat about news. And you can join us by going to the mentalhealthcommission.ca website /English/spaces. And so I would really like to thank Andrew, Claudia, and Laura for joining us today. They've done a fantastic job at sharing their experiences in regards to workplace mental health. And I'd also like to give a shout out to the folks behind the scenes that are getting these webinars together. So we have Miliane, Lori, and Tina, who have worked very hard at pulling these together. Finally, I ask that you take the time to fill out the survey that pops up on your screen as you exit the webinar. It'll help inform the topics in the future, and I'd encourage everyone to ask questions before the next webinar, so please feel free to email us directly. As always, thank you so much for your participation, and we'd like to remind you that our next webinar will be on October 29th, as usual, on our last Wednesday of every month. And so for folks looking for the presentation, it'll be posted on our website in about 2 weeks, and you're welcome to view the recording on our YouTube channel. So thank you to everyone, and wishing you a great day.